Social Services and Deputy Chief Minister. The public hearing will concentrate on common strategic policy delivery and will move into the cross-cutting areas such as delivery of coordination between the departments, the risk identified, managed, outcomes are measured and impact assessed for the people of Jersey. But before we'll start, let's make an introduction. I'm Deputy Ina Gardiner, President of the Scrutiny Liaison Committee.
I'm Deputy Helen Miles, Vice President of the Scrutiny Liaison Committee.
Deputy Louise Doublé, I'm Chair of the Health and Social Security Scrutiny Panel.
I'm Deputy Catherine Curtis and I'm Chair of the Children Education Home Affairs Panel.
Deputy Alex Curtis, I'm a member of the Environment, Housing and Infrastructure Panel.
And online?
Yeah, Deputy Montfort Tadia, I chair the Economic and International Affairs Scrutiny Panel.
Thank you. And Deputy Chief Minister and the Health Minister, please introduce yourself and your team online.
Deputy Tom Binner, Health Minister. We can move on to you, Ruth. We go around clockwise.
Ruth Johnson, Director of Health Policy.
Tom.
Tom Walker, Chief Officer for Health and Care Jersey.
Martin, can we go to Jess?
Martin Carpenter, Director of Digital and Informatics for HCJ.
Scott Hardrick, the Programme Director for the New Healthcare Facilities Programme.
Thank you very much. And we'll start with first general question about common strategic policy delivery. And again, it's really important to emphasize, Deputy Binner, you are here in your role as a Health and Social Services Minister and also as a Deputy Chief Minister, as well looking through cross-cutting areas of the common strategic policy. How does the proposed investment in health services contribute to the delivery of the common strategic priorities, particularly those related to community well-being and reducing inequalities?
Well, if we start with the reducing inequalities, I know that all teams in this area are working towards the SEB's programme of works. It's a shame we haven't got our HR director here because I know he's a little bit concerned that we haven't had quite the buy-in. He's relatively new that we should have had within the health service, and I know he's making some particular efforts to address that situation. But we come back to your question. It was about extra funding, was it, and how that's going to affect the CSP?
The question is, you have common strategic policy priorities, and some of them particular. Let's start with different. What are the priorities within common strategic policy within your remit? And if any of them is in the risk of delay?
Well, the main one that sits within the common strategic policy, as is stated in the main elements, is the hospital project, as you know. And it may be, I wanted to cover this in any event, possibly a good time to hand over to Jessica, who can give a full detail on what's happening in relation to the contracting of a main delivery partner. It's a little bit delayed, but I don't think it's going to have an overall effect on the final completion date of the hospital itself. So it's a good opportunity to hand over to Jessica, who can give some more detail on that, if that's okay.
Very shortly, Jessica, in 2 minutes, and we'll go back for common strategic policy priority to the ministers, to other ones.
Sure. So obviously your question was about how will it impact communities and how can it improve in diversity, equality and inclusion. And clearly a new building built to all modern healthcare standards, such as the buildings that are going to be part of the new healthcare facilities programme, are absolutely going to assist in those areas because they're by design, and all of the HBNs and HTMs that we designed that are part of the brief of all of those buildings clearly will help us deliver to those. And I guess we've already delivered to those insofar as the Enid Kenno Health and Wellbeing Centre, the St Ewald Centre. They've all been delivered already, and they are all on the path to being able to deliver the acute facilities, all very, very important precursor projects.
Jessica, very quickly. What is the delay? What is the risk of the delay and how long is delay?
No, so I think what the Minister said is that at the moment we were taking a little bit longer over the decision for the main works delivery partner. That's because we're in the middle of a procurement exercise, and what we wanted to do is absolutely make sure that we received the information that we needed in order to make a decision. So we extended that process, but overall we're still working to the programmes that the delivery partners can deliver the schemes to.
Thank you. Thank you very much. I have a question from Deputy Monteutadia, please.
Yeah, I mean, just to jump in, I mean, the question is really about reducing inequalities and producing better health outcomes. I mean, you've moved on to the delivery of the new hospital building, but do you accept that just having a new facility in itself is not going to be sufficient if there are current dysfunctionalities within the delivery of healthcare service? We can all think of examples that we've dealt with for constituents. Can you speak to maybe more about what's being done currently to reduce those inequalities and deliver better healthcare without the need of, before we get to the point of the delivery of this new building?
Yeah, I'm very happy to talk about that. I think the main thing that's going to help to deliver a reduction in inequalities, apart from the work that is being done in the HR department to deliver all the training and everything else that's required, is actually to make the health service actually more efficient and more structurally sound than it is at the moment, because it's very hard to deliver specifics like inclusion projects and so on if the core of your operations aren't actually in order. And that's what my findings have been up to date, and that's why we've introduced the partnership board. We're going for this extra money to try and make sure that everything is digitized. So many things are falling through holes in the whole process that until we get the structure sorted out, the core, if you like, the foundations of what we're doing right, it's going to be very, very difficult to coordinate things on externally in an efficient manner. So we're starting from quite a long way back. But I fully appreciate that the need to do all of the work that we're doing. We're trying to do on a day-to-day basis. We're trying to include all of that work ongoing. But the main thing that will make a difference finally will be a good and orderly structure and proper investment.
Okay.
Thank you.
Thank you. Minister, given the cross-cutting nature of health and well-being, how is the department working with other ministers like education, housing, social security to deliver the common strategic policy priorities? Can you please give one or two specific examples how you worked with other ministers and what outcomes were, please?
The best example I can give for that is the formation of the ministerial group. I forget the precise title. It's the Determinants of Health Ministerial Group, which consists of myself, Minister for Social Security, Minister for Children, Minister for Housing. Those four ministers, we're setting up a terms of reference to form a formal group, because they are the four main elements that deliver health and well-being across the community. It's only a relatively small percentage that the health service actually delivers in its own right, and other social matters like housing and so on, and care of children are important. So we're establishing a formal ministerial group. I remember when we had the debate about introducing the advisory board, I was concerned about health with one health minister with such a big portfolio being a single point of failure. I remember making that point. It was one of the reasons I didn't vote for it in the first place. I wanted that addressed. It's taken me longer to get to where we are than I'd wanted. But that group is hopefully going to be meeting for its first meeting before the budget debate. And I'm hopeful that what we'll do is we'll bring all the information through from health to those other three ministers. They will bring concentrated details of what they're doing to that forum. And between the four of us, then we can have a much more integrated approach to bring all the key determinants of good health into one room.
Just before. No, it's really helpful. And I think it's important to have joint approach and to have this ministerial room setting up. As a common strategic policy is coming for almost 2 years, is it anything happened during this just under 2 years that can you give any examples for joint working specific projects that you've done with other ministers around well-being?
We haven't undertaken any specific project work. This will be the first major piece of work that we've done, though I have worked extremely closely with the Minister for Social Security, because I think it's plain to everybody that those two departments interact a great deal insofar as you've got sort of funding for health sitting in two areas, one in Social Security, one within health, and as you know, for long-term care, the health budget picks up any expenses that run in excess of level 4, which causes budget confusion and so on. So we've been trying to work in those areas to define how best we can go forward.
Okay, thank you.
Thank you. Minister, you and I have discussed previously at hearings about marginalised groups on the island facing poorer health outcomes, and I feel that that is well understood. But could you detail, in terms of the wider budget, how will the budget allocations ensure that those marginalised groups, say for example low-income households, see tangible benefits from the CSP commitments?
Okay. I mean, can I turn to Tom Walker, Chief Officer, to provide a bit of detail on that?
Could you give an initial answer, please, Minister?
No, could you repeat the question? Sorry.
So in terms of marginalised islanders, groups of islanders facing poorer health outcomes, we'd like you to look across the CSP as a whole and tell us how the budget allocations will ensure that, for example, low-income households see tangible benefits from the CSP commitments.
No, hands up. I can't actually give you that level of detail, I'm afraid. So I would ask if Tom can assist on that one.
I'll just ask a further question then, Minister. So what I'm hearing is that you feel the principle of this joint working across ministerial departments is a good principle, but that's not really happening just yet. And is there anything that you can give us in terms of the timescales for, say, this group that you've set up, which sounds like a really good start? Do you feel that it's urgent that that group gets up and running so that actually marginalised groups and inequalities are considered right at the beginning of policy making?
Yeah, no, absolutely. As I say, I can only apologise for not having got round to it sooner, but you probably know from the interactions that we've had that health did start from quite a long way back. There's an awful lot to be done. And there just aren't enough hours in the day to get all the things done in the time frame that you want. That said, I'm sure that whilst I'm not able to articulate it with any particular detail an answer to the question that you've asked, I'm sure that there's work going on in this area anyway, and that's why I'm so keen for Tom to talk, because as is the case with a lot of these things, you trust, when you've got a trusted team of officers, you know that some of this work is going on in any event.
Sure, we may come on to your officer in a moment, but we're talking about marginalised groups, and recently in the media there were reports that islanders with disabilities are struggling with the cost of living, and a recent UK report found that on average it costs disabled households more than £1,000 a month extra to have the same living standard as an able-bodied home. This is likely to be even higher in the Channel Islands. And what role are you playing in terms of cross-ministerial efforts to support disabled islanders?
Well, as I say, this side of things normally sits with the Social Security Minister. And as I've already said, I do work as closely as I can with her to ensure that we're getting the job done properly between us.
So, Minister, I think in terms of this hearing, what we would like from you today is to have that holistic view across all departments. And whilst we do understand that there is a lot of work that happens for each minister that within their departments, we do need to see that cross-departmental thinking. Have you considered the needs of disabled islanders in your policy making for the CSP and budget allocations?
Yes, that always takes place. I don't mind raising my hands and saying I haven't done as much cross-ministerial work as I'd have liked in the time available. But as I say, there are only so many things you can do at any given point in time. And from my perspective, there was quite a lot wrong with health from a major structural point of view, and that needed resolving in the first instance. So we come back to what my priorities have been up to this point. But I take your point about the need and the importance of this. And I know that within every department that I'm involved with, there is work going on to this effect.
Thank you.
And it would be helpful if
Sure. Could you commit when this group is established could you commit to tabling on the agenda islanders with disabilities and how they can be assisted with health-related costs such as prescriptions, travel to appointments, access to therapies and other barriers to care?
Absolutely, I have no problem with that at all, and that's one of the principal areas that we'll be looking at. Then that was one of our principal intentions in the first place. So yeah, very happy to commit to that.
Thank you.
Okay. Thank you very much. I'm really asking the next set of questions in the context of you being Deputy Chief Minister. So we know that the Common Strategic Plan narrowed its scope to just 12 core priorities that was later expanded to 13 with the addition of carbon neutrality.
Yeah.
In your view, has narrowing the focus to a limited set of priorities worked?
I think it is helpful to not have too broad a portfolio of things to attend to, because otherwise I think you're doing better off doing a small number of things properly than tackling too much and not getting any of it right as a principle.
Can you tell us whether it's exposed any challenges in addressing some of the more complex interconnected issues?
Nothing springs to mind particularly, but I'm sure you probably have some examples. I can't be offhand, and I have to say, and I don't mind confessing that because health is such a broad portfolio, and it was driven with so many difficulties when we took office, that most of my focus, I'm afraid, has been on health and health-related issues, possibly to the detriment of being as I would normally like to have been in the Deputy Chief Minister's role, had I had a slightly easier portfolio to deal with. I don't mind making that point absolutely openly.
Okay, thank you. To what extent then have you been able to influence funding allocations to support your own strategic priorities?
We'll know at the end of the budget debate, but I put an awful lot of effort and had to use all my powers of persuasion over the last few months to get the budget allocations that we've got in the forthcoming budget. And I have to say, I don't mind saying publicly, I'm grateful to other ministers for eventually settling into accepting that they weren't going to have the extra money that they wanted, because a lot of the money was going to health.
Thank you. Just looking at the current budget, what would you have liked to see included that isn't there?
In relation to health, or in the broader.
Well, in the broader sense.
Right. I'm going to go off at a bit of a tangent because you've asked the question, and I hope you don't mind me going here. I had been working on what I referred to as, it was somebody else gave it the name of Project Breakwater, which was a considerable investment in health. The money that we've got coming to health, I'm very, very grateful for. It's not quite as much as I would have liked, but it also included some a major investment in infrastructure, and that was not to be taken from savings in the way that it's been incorporated into the infrastructure, the overall 20-year infrastructure plan. I would really like to have seen some raw commitment right at this stage to start investing in public realm and sports facilities more immediately. That's slightly disappointing. As ever in government, there has to be compromise, but I think, I know I'm going off at a bit of a tangent here, but I think Jersey needs to refresh itself as an overall offer, as a product for tourism, and in order to make sure that we stay at the top of our game in terms of attracting business to the island and tax-paying major companies. So that's. If I feel any disappointment about anything, it's that a lot of that got dissolved in the course of negotiations, and it's something I'd like to see revisited in the future, because I still think it's as I say, Jersey it is a product, it is an offer, and I don't think as the two governments in which I've served, I don't think there's quite enough emphasis on getting more money into the system. We should, in any business, you'd be focused, your primary focus would be on bringing in more money. It's much easier to be generous and to get things done when you've got more cash. So I've probably done a bit of a soapbox exercise there, but you did ask the question, and that's my answer.
My final question, thank you for that explanation. What do you consider has worked well, particularly in your department, in delivering the actions and priorities that have been assigned to you?
What's worked well? I just think that there have been some new appointments. I mean, as with any situation you come to from scratch, you find a team of people that are with you to start the journey. I'm now very comfortable with the team of people that we're working with now. I've been comfortable with the hospital team from day one, and I'm now extremely comfortable. When I say the new hospital team, that's the project, new hospital project team, and I'm now extremely comfortable working with the team of people in the health service at all levels. That's particularly in the state section, but also obviously with the GPs and the charities. And I think the future looks quite bright with the right people in the room.
Thank you.
Deputy Chief Minister, I would like to follow up and to seek your views. You said, and I agree, that we would like to have more cash and more income, but we are where we are. What are your views of withholding almost 74 million from 2026 and £250 million from the Social Security Fund?
Yeah, I don't think anybody's going to rest terribly comfortable with that. But I think politically we all have to accept that we're living in a slightly different world. I think politically we've been in a very, very fortunate position over a long period of time that all the money that we've really needed, we've had. The public seem to be demanding more and more from government as we go forward. That's perhaps understandable. Everything changes. And there's a need to respond to that. So there's a requirement to be putting more money into delivering more and more services. And I think another thing that's quite difficult that we're going to have to confront is the fact that we pay 20% tax in Jersey, and I get an awful lot of emails saying, I want this care and I want that care because I've paid my dues all my life. But the truth of the matter is, probably not one of us has paid as much as we should really have paid in if we want the level of service that we're now expecting. Coupled with the fact that we've got an ageing population and a shrinking workforce, or certainly a workforce that isn't growing at the rate that it should to sustain the care of the amount of older people that we've got, something we've got to revisit. So that puts us in an awkward position.
Yeah, but it was mentioned that the Social Security, withholding from the Social Security Fund is temporary for 4 years. But problems that you mentioned are problems that challenges will continue. We'll continue to have aging population, we'll continue to have requests for the services. So is it really temporary?
Well, it may be that it's partially temporary. I don't know what the future will hold. I don't know what the next parliamentary session will bring about in the next 4 years. I'm very hopeful that there will be more focus on making the island yet more attractive and bringing in more money, because that resolves the problem before you start. We may only be able to resolve that to a certain extent, so it might mean an ongoing take of some of that money. I know that you could easily argue that some of the cash that's coming out that would be coming out of the Social Security Fund would be coming to health, but we have to face a very crude reality. If we don't take that money and spend it on health, mark my words, and you can talk to any of the people that are here online with me, if we don't address some of the problems with health and do more preventative work and get digitally connected and become more efficient, the health service will eat the whole of our budget within 20 years. So we've got to face that reality, got to put that money in now. And I think that common sense dictates that that's going to take away some of the exponential growth that we're seeing in health costs. It's not an option in my view.
Yeah, thank you. And I'm handing to Deputy Tadia.
Just to drill down, thank you, Chair. The Minister, you talked about people expect a lot from a 20% tax rate. You said we all pay 20% tax. So, yeah. I mean, to be fair, on our taxable income, there are different rates. So some people pay 26% tax on their taxable income. Some pay 20. Companies pay 0 often, or 10%. Or 20%. Some very wealthy individuals are capped at 1% on some of their income. What are you saying about the tax rate that might need to change in the future to meet the demand of the public?
At this point in time, nothing specific. I think, but I'd need to think long and hard before I made any particular open statements about where we go from here. It's a long and complicated problem. As you know, this relates also to health costs and whether we actually introduce some charges for health over the course of time or introduce an insurance system. There's lots of options, but as I say, the first thing for me is to get everything running as smoothly as we can, then and using some of the money that we've got available to us now. And that's important because what we can't do is worry about structures for getting more money in or different tax regimes before we start sorting out the core problems. So the emphasis has been on sorting out the core problems, and the next stage after that, once things start to settle and move in the right direction, will be to look at these bigger questions. So as I say, it's not that I'm haven't thought about it, but I've not thought about it to a sufficient extent to be able to be in a position to make any public statements about where we need to go. You can understand it would be political dynamite to have some guesswork going out there and just throwing ideas on the table. It's not the way we should handle it.
I mean, very quickly, if I may, Chair, the question that arises, I suppose, is that if you're creating a new structure or a new system that you envisage may require ongoing investment to keep it running optimally, at what point do you decide about how that is going to get funded sustainably and start to have that conversation with the public?
That's something that we need to start that. We need to start that process now, probably in the new year. I would say is a reasonable time. Let's see how we get on with the budget. Certainly from our point of view, getting our partnership board underway. Get everything smoothed out, and then we can start having those discussions.
There is
so before the election, okay. Thank you, Chair.
Yeah, thank you. Yeah,
I think Deputy Taddeo may have covered this, but Minister, in terms of the Health Insurance Fund, and the figures that my panel have seen indicates that the current spending, if these budget commitments are approved by the Assembly, that the recurring spend in that respect can only continue at that rate until 2035, at which point the fund will be empty. Now, I think we all understand that a long-term plan needs to be made, but shouldn't that long-term plan start now rather than just having a short-term plan and waiting for the next government to make a long-term plan?
No, I don't think we're going to be waiting for the next government to get started on a long-term plan. That work can start in the new year. But if you bear in mind getting everything ready for the partnership board, doing all the work to try and get everything ready to get the extra money into the budget has taken a certain amount of time. We've got assisted dying that sits within the portfolio. That's coming up for discussion, as you know, at the first session in the new year. Let's get all of that work done, clear the decks, and we can start the work in the new year and going into the election period. And I don't mind starting to make some, unfortunately, as I've said, there's only so many hours in a day, and you can only have your focus on so many areas at any given point in time. But I'm very happy to start looking at this seriously in the new year and coming out with some ideas before we get to the end of April.
Can I have the final one? So, Minister, when will islanders have some certainty around how that gap is going to be plugged? Will that be available to islanders in the next 6 months or beyond that?
Well, I don't think we'll have complete certainty before the next election, to be fair. But I think we'll have some indicators as to what needs to be done and perhaps some first ideas, some initial suggestions as to how we might go about it. But that's a long piece of work, and that's going to need consultation. It's going to need understanding. We're starting the process. Another thing that's actually taking up our time now is that we're having we're going to do 2 presentations the week before the budget. One is going to be to everybody in health. That's everybody within HCJ, the charities and the doctors. And we'll be giving a very similar presentation publicly the night after. We're getting the dates organised and the venue organised now. So this is starting the whole process of updating the public on what we've been doing, why we've been doing what we're doing, and the challenges that confront us and the things that we're going to be looking at into the new year. So that's work that's being undertaken at the moment. And states members will be invited to attend either one. So they've got an option of the 2 dates. They can either attend the one with the professionals or with the public, or both if they see fit. But as I say, we're working on that. It's only really come to the fore in the last few weeks, but that's going to be quite interesting, I think.
Yeah, thank you. And I'm going back to Deputy Taddeo.
Thank you, Chair. We're going to turn to GP sorry, I'm a bit lost here online. I'm going to ask you a question about the community risk register. So could you advise about the allocations in your department, how they've been informed by the community risk register, and if you're aware of what the key risks remain in your area?
Yeah, I periodically look at the risk registers, both for the new hospital project and for the department. I know we've not used any of the officers that I've got with me, but can I hand over to Tom on this one?
Please.
Would that be okay?
No problem. So Tom Walker, Chief Officer of Health and Care Jersey. I think, Deputy, on the community risk register, the primary risk is pandemic flu or COVID of some sort, and so that remains the risk that we're still managing. We do that primarily through the health prevention, health protection function within public health team, and that's done through the Resilience Forum so that we're as prepared as we need to be. One of the things that's on the legislative work programme is to update the legislation in this area, which was one of the learning lessons from the last pandemic. And that's something that Ruth Johnson, the policy team, are working on so that we're as prepared as we can be.
Okay, thank you. And we'll go to the next point. Proposed A&E and outpatient non-attendance fees. Minister, priority 9 in the Common Strategic Policy pledges to keep fees, duties and charges low to ease the cost of living. However, the proposed budget seeks approval from the State Assembly to introduce 2 new charges levied by Health and Care Jersey to promote appropriate use of emergency department and the repeated non-attendance of outpatient appointment. How do you reconcile these charges with the government's stated commitment to ease the cost of living?
I have to make the point that there's 2 things. There's A&E charges and there's non-attendance charges. The non-attendance charges, and I'll make the overall point that neither of them are intending to be revenue raisers. In any event, they wouldn't raise very much revenue. This is about driving behavioural change. I certainly don't think it's acceptable that one appointment in 10 doesn't get attended and nobody knows about it. That really damages the efficiency of the health service, and that contributes to extended waiting lists. So I don't have any problem at all in suggesting that if people do that on the second occasion that they do that, that they should be charged, and the charge is half the cost of what it actually costs the health service to deal with that. So that's one that I don't have any problem with. And the intention is I'd rather everybody either attended their appointment or gave 24 hours notice that they couldn't attend and have no revenue, because the efficiency savings would be colossal. Okay, so that's how I deal with that one. The A&E charges I'm a little bit less comfortable about, because what we won't do is introduce them if we think there's going to be any harm to anybody, if anybody would become ill as a result. So we need to think that one through very, very carefully. But once again, it's about making sure that people that should be going to a GP go to a GP. Because if everybody that went to a GP turned up at A&E to get free treatment, the thing would absolutely collapse. I think our A&E is 2.5 times busier per capita than any other A&E in the UK. I believe that's correct.
Yeah.
And once again, the introduction of charges would be in order to try and drive behavioural change, not as revenue raisers.
Minister, in the public hearing with my panel, you stated in regards to the A&E charges that you did not really want it. Would you consider removing this from the proposals?
No, I'd like to give it some more thought, because we have got a problem with attendances at A&E, and I think we also got to bear in mind if you do go into A&E with something really serious, and I'm not going to go into personal details, but I've had people writing to me that really some pretty horrible conditions that are left 3 to 4 hours, and they're seeing people going before them that haven't. Well, there's been a huge, not so much a reduction in. Well, there's been a reduction in what the public had charged for GP fees, and I think if you're an income support, it's down as low as £10. I think the GPs were left 10 years without any changes, and I think we need to be looking at that every year, addressing that every year. It should be an annual situation rather than left 10 years. And so there has been a big drop,
Thank you.
and that does make me a little bit more comfortable.
Thank you. And I'm handing back to Deputy Tadia.
Thank you, Chair. Very quickly, Minister, what level of support do you have from your ministerial colleagues for the introduction of charging at A&E for missed appointments?
It's under this. Well, I think we're all equally concerned that if we do introduce charges, that nobody physically suffers as a result. We all share that in common.
Sorry, when you say you're equally concerned, do some of you have more concerns than others? Who are the ministers that wouldn't? I mean, you don't need to name names, but what numbers of support do you have, or how many oppose this?
Are you talking about council ministers or my own assistant ministers?
Council ministers, yeah.
Council ministers. I don't think there's, to the best of my knowledge, nobody's openly opposed it. And I haven't really taken a straw poll, but it's something that we won't do unless we're comfortable.
But it's been to COM, has it?
It's been discussed in principle.
Okay, thank you.
Yeah. One supplementary from Deputy Curtis.
Minister, on the matter of missed appointments, has any research been done on the reason for the missed appointments? So, for example, about how many are due to appointment letters not being received or with inaccurate information, for example?
We haven't done. Tom, Chief Officer, might correct me, but I'm not aware of any specific work that's been done. But we are aware that our appointments process isn't as accurate.
Is it frozen? Or it's an open... Minister, are you with us? It's frozen.
I think that might have frozen, Chair.
Might frozen.
But just to pick up the point that the Minister was making and the thrust of your question, Deputy, it's absolutely the case at the moment that the administrative process for appointments, is very analogue and not what it needs to be. And so part of the digital plan for next year is to move that into a more digital solution so that people can see their own appointments online, they can communicate with us about the appointments, and we can make the whole process much better. And that was why on page 28 of the budget, the commitment was there in black and white that we wouldn't seek to progress with charges for people who repeatedly don't attend until we've improved the system through the digital investment that we need to make. We need to improve our side of things before we can ask Islanders to really do their part as well.
Thank you.
I think we'll wait for the Minister, but because we have question on digital, we will still with Martin, and we'll come back to GPs and ageing population when Minister will rejoin us.
Okay, so I think, and maybe the Minister will touch on some, but he may have delegated to you, Martin. We would like to ask a few questions about digital health, and particularly investment proposed and how that ties to the common strategic priorities. So first, at a high level, how does investment in digital health systems within this budget support the government's commitment to, as one of the policies be, deliver the best outcomes for islanders and work in an inclusive way for all?
Thank you. I think there are a couple of areas that it supports the priorities. So first of all is around building a new hospital and making sure that the hospital is an efficient part of the overall health system. And then the second element is around demographic preparedness and making sure that we're sustainable as we have a more ageing population. So at present, the key areas where we are challenged is the continuity of care between different providers is hampered by the lack of digital integration. So, for example, when patients are referred from GP practices into Jersey General Hospital, potentially off-island care, into domiciliary care, into family nursing, the flow of data is not enabled digitally, and that results in inefficiency and also poorer health outcomes for islanders.
Okay.
With the change in demographics, it's likely that there's going to be more activity in future, and that will cause more inefficiency and worsening outcomes for islanders' healthcare.
Okay, I want to pick up quickly on something the Chief Officer of Health and Care Jersey mentioned, which is that having the appropriate and dynamic digital processes is a barrier to delivering some of the more responsive policies, such as non-attendance fees, and understand whether within the funding, obviously, the Minister touched on his ambitions for funding in health, digital health not being fully addressed in the budget, how those two impact on, or how your funding and your kind of priorities deliver against those challenges.
In a couple of ways. So the Chief Officer was right to say that we are investing in a portal which will allow people to have access to appointments and test results. That channel shift will allow us to create capacity for those people who don't have or struggle with digital access. So we're creating more analogue capacity. So that goes towards helping to reduce health inequalities and improving access for islanders. The other area and the key investment that we're making or want to make is in a single patient record, which will allow us to get a holistic view of islanders' health needs. And at the moment, that's very fragmented.
Okay, and I will. We've touched on it, so I'd be interested to understand more on the single patient record. We're aware, or I think most states members are aware of the variety of systems. There's, those used in the NHS, there are those in other countries. What work is done to understand the scope of budget and the kind of the feasibility to deliver meaningful progress in that area with the current budget, and whether what's being designed is the right scope and shape for Jersey's existing digital ecosystem?
We have to recognise that whilst we are very connected into the NHS in terms of working closely with NHS colleagues for off-island care, we are significantly a different size and shape and jurisdiction to the NHS. And we can take lessons from other jurisdictions in terms of best practice. So the approach that we're proposing to adopt is an approach that's used in Estonia and Catalonia, which has used a single patient record using systems which are non-proprietary, which means that Jersey will own its own health data and not put them in systems which encourage vendor lock-in.
Okay, and part of the wider budget that is scrutinised by other panels, including the Corporate Services panel, is investment in IT infrastructure. To what extent is the allocation between core IT infrastructure and digital health, in your view, kind of addressing the requirements to deliver digital health on top of the government's existing estate?
I've worked very closely with colleagues in digital services to ensure that the proposed investment allows us to create capacity to enable us to deliver what we believe is a step change in the maturity of systems. And so part of that is addressing legacy, which has been underinvested previously.
Okay, and lastly from me, part of the Common Strategic Policy focuses on the future Jersey outcomes, including the outcomes of a vibrant and inclusive community. Again, visiting that reduction in kind of digital health ambition because there isn't the funding available that the Minister touched on. To what extent is a vibrant and inclusive community part of the immediate focus on digital health, and to what extent have other compromises had to be made, and where were they prioritised?
So it very much was part of our original plan, and we've had to make some compromises as the original plan that we submitted has been not deprioritised, but money has been reduced. So one of the things that we wanted to do, through creating the single patient record, will allow us to be able to have a much better understanding of where health inequalities sit and the communities that are underserved by those inequalities. And we were proposing to have a advanced analytics platform to put in place for that. That work is potentially slightly hampered by the reduction in funding, but it is definitely an ambition that we have to be a lot more data-driven about where the health system needs to focus in terms of having those, as you said, vibrant and inclusive communities.
Okay, thank you very much. And the Minister, welcome back. And we'll move, we have two more areas of question. And the first one, it's about GP fees as it's part of the Common Strategic Policy priority. And I'll turn to Deputy Tadia to start with GP questions.
Thank you, Chair. Minister, can we ask, is there a consensus that the increasing subsidies to give to GPs to reduce fees is the correct and most effective way forward in terms of delivery of primary health care?
Yeah, I believe there is a consensus in that regard, yes.
Okay. And can I also ask, has consideration been given to perhaps other models of delivery? Has any discussion happened at either within your department or at Council of Ministers about whether or not, especially for those who struggle with the cost of a GP, that the hospital may directly consider employing GPs, for example, rather than having a pan-island subsidies that seek to drive the cost down?
No, I don't think there's an appetite for that. Certainly not to my knowledge. Not within this sort of small ministerial team amongst myself or my fellow assistant ministers, and I've not had that suggestion made to me by other ministers either. I think when we compare what we've got in GP services to the UK, I think we're very, very well served, and I think our system works well and should be encouraged.
Do you accept that there are probably inequalities in terms of who gets to access GP? So if people who are reasonably well off don't necessarily think anything about paying the required fees if they can afford them, and they may appreciate the availability, but for those who can't afford even the reduced fees, saying that there are shorter waiting times for GPs is not much comfort if they can't afford to go there in the first place. So to what extent do you think the new subsidies, how much can we drive down the cost for those who need it?
Well, at the lowest level, we're at £10. There does have to be a break point at which you say, and I'm not a great believer in going down to everything being free, because as we've seen, when everything is absolutely free, people tend to not really regard it properly. And I think some sort of fee is probably appropriate. Whether £10 is the right fee or not, I don't know, but it's certainly a lot better than it was 3 years ago. So it is much more accessible. It's a fine balance, isn't it? And as to whether you make more money available to people to then spend that £10, or whether you actually reduce that £10, I don't know. It's a vexed question.
Okay, and I appreciate this doesn't all fall within your gift, and that you do need to have cross-cutting work with the Minister for Social Security. So, I mean, what role have you played in advocating for reduced GP fees as part of the wider health strategy?
Well, to be fair, the current Social Security Minister, as you know, has been very committed to doing this without any particular input from me, and I've been quite happy with the work that's been done. So it hasn't really been a major area of discussion, simply because those rates have been brought down since the current minister's been in place, which I think is all to the good.
Thank you. And I will hand to Deputy Double.
Thank you, Minister. You mentioned that the lowest cost would be around £10, and I note that some surgeries are charging £0, some are charging £15 for standard appointments, and there is a wide range. And Minister, you've mentioned that you think that discussions with the GPs should happen every year rather than every 10 years. So clearly there's an appetite for some change there. As part of your work on sustainable health funding and the structure of the healthcare system, will you ensure that GP fee reform is considered within the broader financial modelling for health services, and that a hybrid model of the government perhaps employing some GPs and also some subsidies to GP surgeries, that is at least considered as part of that work, so that the merits of that model can be fully weighed up?
I'm happy to consider it. As I say, I've got to be honest with you, I haven't got a particular appetite for going down that road myself, but certainly it can be up for consideration. And I certainly, in terms of the way that GPs go about their business, I want all of that to be tightened up when we've got the partnership board in place. I think that there can be areas of specialisation within GPs to a greater extent perhaps than there is at the moment. So there's a lot of work to be done in working closely with the GPs. So nothing's off the table, but as I say, I don't have an appetite for a huge appetite for changing what I don't see as being terribly broken at the moment.
Are you able very briefly to indicate some more detail on what you mean by things should be tightened up?
Well, at the moment, we've got PCB, the primary care body, and some practices are more engaged with the whole process of being part of a wider health service than others. And I'm very keen that every practice on the island becomes a full participant in the process. And I'm trying to get a situation. I'm trying to get an initial meeting with the lead from every practice to turn up to a meeting. So every practice is represented at a meeting that we can open discussions on how GPs play a greater part in being an integrated part of a delivery of health services.
Minister, as Deputy Double mentioned, there are some GP practices that charge 0, some charge 15, and some charge just under £50 per GP visit. The range is really, really vast. As government currently paying to each GP patient visited just above £50 per patient from the government to GPs, and each GP practice put in their own cost, do you think it's actually your common strategic policy priority, reduce GP fees, worked?
I think the reduction in GP fees has worked, and I think you've actually highlighted the benefit of having a choice of different providers. And if people are short of money and there are GP practices offering a certain number of free appointments, then that's got to be to the good, I would have thought.
Yes.
Do you believe that GP fees should be capped?
But if there's a variety and people have got choice, why would there be a need for that?
There may be many reasons, but do you believe they should be capped?
It's not something I've given full consideration to be fair.
Okay. Thank you, Minister. And we'll go to Deputy Curtis and aging population.
So, Minister, we've already heard about the digital improvements should help with continuity of care and things like that for the ageing population. But what what else has been factored into long-term service planning and budget priorities for health around the ageing population?
Well, it's something that we're dealing with as we go forward. Obviously, there's got to be provision in the new hospital facilities programme to facilitate the ageing population. The new hospital, from an acute point of view, will be able to do that, and the health village will also be required from a physical point of view to help to accommodate that, in terms of particularly the numbers of people with dementia are going to increase and so on, and comorbidities and other complications. Well, I think that the whole programme of works, health prevention, if we can use that £4 million a year to good effect, we're going to take away some of the excesses of things that go wrong in older age. So I think the direction of travel everywhere within the health service is fully cognizant of the fact that we've got a major problem coming forward with an ageing population.
Thank you for that. So that's quite expensive, I expect. So to what extent are you aware, if any modelling has been undertaken to assess fiscal pressures arising from these changes?
These things are under review. Can I bring in Ruth Johnson, who I think might be helpful
Minister,
with some
we
details.
just have 5 minutes left. So basically, I think if you can just answer the question, are you aware about the modelling done or not?
Yes, there is modelling. There is modelling going on, and as I say, that changes as we go forward, and that all ties in with the need for identifying how much extra money we're going to need, because we're going to need to employ more people, look after more old people, and we've got the physical problem of not having enough young people to do that. So they're all things that we're going to be looking at as we go forward. They're all recognised as problems and things that we are looking at.
Does robust data already exist on the extent and nature of care being provided by islanders and its value to the economy?
Is that in terms of what carers, home carers do?
Yes, what unpaid carers are doing.
To be honest, I don't know what data has accumulated. It would be helpful if an officer could help in that situation.
Yeah, Ruth, if you can very shortly, what data we have and what modelling done or you are doing currently?
So in terms of, if you're talking about data relating to the additional costs of meeting the needs of an ageing population, that is being factored into some work that we are doing around projecting forward our future health and care costs within the system. With regard to whether or not we have data in terms of the financial contribution that is made by family carers and by unpaid carers, it is an area of work that HCS has just started to look at with regard to how we can deliver better care and support to carers.
Thank you.
Okay, so that's just been started to look at. Okay, and in what ways is the government ensuring that workforce and skills planning keeps pace with these demographic shifts?
Ruth, do you want to answer that as well? Or?
Sorry, I didn't catch the question. Could you repeat it?
It's about ensuring there are sufficient people in the workforce to help look after older people.
I think that's probably one for Jessica, isn't it?
Yeah, I think Jess could answer that one.
Absence of the HR director from HCJ being here, an element of work that the new healthcare facilities is undertaking in combination and to be obviously overseen and reviewed by all at HCJ are the workforce implications of the new healthcare facilities. But in order to be able to calculate those, you have to be able to think about the wider HCJ picture. So we are currently undertaking that work on the workforce that will be needed, and all of that work will form part of a workforce strategy that will then form the full business case for the new healthcare facilities programme.
There's a couple more questions. Thank you very much. A couple more questions around ageing population with Deputy for the Minister.
Okay, so this is about the age-friendly framework. So as a result of this P50 2025, We understand that the Chief Minister is working with the Ministers for Environment and Infrastructure to develop and introduce the age-friendly infrastructure framework. What involvement have you had in these discussions?
To be perfectly honest with you, at this stage, precious little.
And do you have any views on this?
As they go forward, I expect to be drawn in, but as I say, it does fundamentally sit with the two ministers that you've identified. So it's a little bit on the periphery from my point of view. Not that it isn't a good idea, but it isn't something that fits directly in with the work, the key work that we're doing, the core work that we're doing at the moment.
Okay, are you aware of any cost-benefit analysis to demonstrate long-term savings from age-friendly design?
No, I have to be honest with you. No, I'm not aware.
Okay, just a question now about the hospital then. So the site master plan for the new hospital includes features such as accessible parking, public transport links and pedestrian routes. How is your department ensuring that the new hospital will be inclusive and accessible for all islanders?
Well, inclusivity has been part of the key work that's been all the way through the entire process. Probably helpful if we just give 60 seconds to Jessica to open it up a little bit.
Yeah.
So I think I sort of touched on this point, I suppose, at the beginning of this meeting where I talked about the brief absolutely being around inclusivity and making sure there was an equality of access for all different parties. And is absolutely fundamental to the design. Of course, that's a very, very broad area, and it's something that we are meeting with all of the various different stakeholders within the accessibility community. And particularly in the next few weeks, we'll be holding workshops with them and also talking to the Minister for Social Security about accessibility in particular, because as you know, it's her department who looks after a lot of the groups who are working in that area. So the answer is it's been constantly borne in mind. And of course, we're talking to all of those stakeholders, and they have a particular opportunity in the next few weeks so that we can perfect the very detailed design that we're getting into now in order to make sure that any of their concerns are taken into account.
Thank you. And we have two more wrapping up questions, one from Deputy Doublé and one from myself.
Minister, there are around 21,000 islanders living in poverty, as indicated by the income distribution report. 4,000 of those are children. As you're aware, poverty is a key driver of poor health outcomes. Can you indicate what cross-departmental initiatives you're part of, which will tackle the causes of poverty and the poor health outcomes that go with that?
Well, I think we come back to the initial comments that I made about having to focus on our core problems, which I think we've done. And I refer back to the ministerial group that we're putting together. And these are the very issues that we'll be focusing on once we get up and running.
Thank you. And my last question, Minister, the health care jersey had the highest increase in the budget, which was required. It was also the highest increase from 225 million to 381 million within 3 years. What guarantee can you give to islanders that this money will deliver the standard of care that they deserve?
Well, I think there's a number of things. I'm going to be issuing shortly a précis of how that money breaks down, because I've seen headlines saying we're getting extra £60 million. Nothing could be further from the truth. If you strip it all back down, and we've done this, we've got it all onto one side of A4. Included in the new number is £22 million that have been transferred from the ambulance services. We've got a strong element of standard inflation. We've got the extra formula that has now gone from 2 to 3% above inflation, and I'm very grateful for this. Instead of underfunding the health service and coming up with a deficit every year and moaning about a deficit, we've now got what we're now calling our baseline funding recognised, and there's an extra £12 million in the budget at the start of this year, so that we've got a fighting chance of coming out with a balanced budget at the end of the year. So I think All of those things need to be understood. I can never give any absolute guarantees about anything other than the fact that I can vouch for the fact that I said at the beginning, there's now a very good team of competent people with a very clear vision, and that vision is to have a first-rate health service in time to move into a first-class hospital in 4 to 4.5 years' time.
So would you clarify? Would you think that with this funding, which we are all thinking about along the same lines, will the standard of care overall will be maintained or increased or decreased?
I'm comfortable, but I have to put in this caveat. Over the next 4 years, I'm sure that the public will see a decided improvement.
Okay, thank you, Minister.
That I'm certain of, and I certainly, if we weren't putting this extra money in, I think they would actually see a decline in service. So yes, as far as public confidence is concerned, if we can continue to get this funding through over the next 4 to 5 years, by the time the new hospital opens, there will be a considerably better health service in place than we have at the moment.
Thank you, Minister, for your time and for your team. And the public hearing is closed. Thank you very much.